cases reported. SWAP Kenya, a local NGO providing sexual and reproductive health services to key populations and other marginalized populations within Nairobi, has established a GBV response and support center to ensure timely and complete redress of these cases. Joining us now is Gloria Gaki, the CEO, SWAP Kenya. Good afternoon once again, madam. Thank you for joining us on this broadcast.
Good afternoon.
Great.
Thank you for inviting.
Certainly, we apologize for what happened earlier, but let's just start with where we were, where you were painting for us a picture of the situation as it is on the ground.
Yes, I was saying that we have noticed an increase on GBV cases during this lockdown, but even the previous, the fact that we serve marginalized population and the KP population in our county, Nairobi County, they seem to be more victimized than the general population. So there's quite an increase of GBV cases, yes.
Indeed. So what exactly is the issue? Because these cases have risen, especially now during the COVID-19 pandemic. We know that people are staying home longer. The government is actually asking us to stay home if you can. So what exactly is the issue, especially with gender-based violence, before we get to teenage pregnancies?
Okay. The violence happens in different settings. We've noticed an increase of violence at homes. The fact that we also serve female sex workers, a lot of family members do not maybe know what they do, and now that they're staying at home, we have also noticed that they get to be violated more. In addition to that, violence can happen in any area, on the way, even during the day. Not only does it happen at night. Yeah, it's very common all the time.
Okay, let's now talk about the teenage pregnancies, and I'll still ask the same question because, you know, when I remember last year during the KCSE, we witnessed a lot of girls who were pregnant and the blame was on teachers. But now these children are home, and we're seeing a rise in the number of teenage pregnancies. And I'm also interested in Uganda because I understand that during this period, the COVID-19 pandemic, over 2,000 girls have also had, you know, these teenage pregnancies. So is it the parents? What's the problem?
For the teenage pregnancy, you notice that the girls are at home for long hours than usual. And also the fact that we have young people who are idle. Idle mind also means that the girls need to think of what to do. They sit at home, they have nothing to do, like now there's no school, they're not going to school. So they tend to venture to other areas. Young people need to utilize their energy, they need to focus their energy to something else. And the fact that like in Nairobi where there's no maybe agricultural activities or there's not much chores they can be given, they have more idle time. And it means that they have more time to explore, more time to venture out, more time to experience. And that's where we notice a lot of girls getting pregnant. And we cannot blame the parents because the parents have to work. So the parents go to work, they have to bring bread for them. And when they are away, the girls now are left at home and they're left to the neighbors. Yes.
So now what happens? What needs to be done? Because we now have two problems on the table. Teenage pregnancies, gender-based violence, rising over time, especially now with this pandemic. And this is definitely going to continue. We don't know when, say, COVID-19 will come to an end or a vaccine will be found. So between now and the end of COVID-19, what needs to be done? Because we are seeing an increase in these cases every single day. It has actually been a concern to the Ministry of Health.
What needs to be done is what is happening right now. We need to start conversations. We need to include forums where both the parents can talk and they can talk with their children. But also we need to create a lot of awareness. For everybody, both in the country and internationally, COVID-19 has happened to everybody. It's a new thing for all of us, both the parents, health workers, children. And I think think it's an opportunity for us to do in these settings. It has happened to us. What can we do about it? And we take actions. And the urge is that we need to form forums of different stakeholders who are involved with the children who are at home, to engage them, even if it's on social media, to give them activities that can keep them going. Also to empower the parent. We know that it's not all the parents are able to talk to their children. This is something that people can get skills on how to engage the young girls, to talk to them. In addition to that, for the parents who have children at home, we are urging them to talk to the girls and to be observant, not to ignore some of the signs. There are signs that can show a parent, a child is being exposed, has more information than they had before, and can guide them. So we are urging the parents to be more observant, to channel their children towards the positive behavior, but more so to talk about it. It's not time we can keep quiet. It's time that we have to talk and engage the parents, engage people who can talk to the children, even if it's neighbors who are able to talk to the children, and more so if there's opportunity to do some energy involving like sports, that will be very key.
Indeed. How about for GBV, gender-based violence? And you could also talk to us about what you're doing in SWAP Kenya.
Yes, SWAP has been providing sexual reproductive health services for the last 12 years in Nairobi County. And with the increase of the GBV, we decided with our partners, especially the Nairobi County governments, the Metropolitan Medical Services, our donors, to improve the kind of service that we provide to our population. So we came up with a center that we call WEMA. WEMA means wellness for the women, where they can get all the services on GBV. These include medical services, psychosocial support, and the long-term mental health support that they don't get. Why we are doing this is because mental health affects individuals, gender-based violence affects individuals in very different sectors. One of it is sexual. Sometimes when sex happens to an individual and they do not talk about it, it goes to affect them psychologically. So we have created a WEMA center where this individual who has experienced any gender-based violence has an opportunity to come and talk to a health provider with the skills to empower them, to ensure that they are able to get therapy that can help them to adjust to the community back. Because when this is not addressed, the individual is not able to live their life to the fullest. Once a sexual violence has happened to anybody, they are never the same until they have an opportunity to voice it, to go through long-term therapy. In addition to that, there's a medical services that they need to get. We'll provide things that could prevent them from getting infection, HIV infection, STIs infection. This means we'll provide PrEP, we'll provide PEP to prevent HIV infection. We'll also provide, so this WEMA center is a one-stop center for the individual who has experienced gender-based violence in Nairobi County. It is located in CBD to be able for easy access to very many people within our town.
Okay, Madam, I'm curious, do we have any, say, latest statistics? I know we have the statistics that the Ministry of Health has been giving out in their daily briefings on the COVID-19 situation in the country, but do we have the latest statistics for GBV and also teenage pregnancies?
Maybe I could talk for SWAP. As I indicated earlier, we've been seeing about 10 cases of sexual gender-based violence among our population who come to receive services here, and more than 100 cases of physical violence among the population that come to our population. This is out of about 5,000 individuals who get services within our 7 locations in Nairobi.
Okay, now, Madam, if I could take you back to what we read as I introduced you, because there's a statement that caught my attention, and just allow me to read it again. It says, evidence suggests that gender-based violence is not only a human rights violation, but also a barrier to HIV prevention, treatment, and care. I want you to take us through that, how this is a barrier to HIV prevention, treatment, and care.
One route of HIV infection in today's setting is through sex. It's even worse when sex happens through violence because there's a lot of tear that happens. That is a sure way of getting an infection if an individual does not receive quick medication. So for us in SWAP, through the WEMA Center, what we do is that we encourage individual who has received as SGBV to come to the service, to the premises within 72 hours. When they come through to the clinic within 72 hours, they'll be able to get a PEP that will prevent them getting infection. But once it goes longer than 72 hours, there's a higher risk of getting infection. So what we have noticed is that the individual who we have had about the last quarter, this is about 3 months ago, individual who got raped and were not able to get services within 72 hours got infected. What we call they got seroconverted. They were once negative and they got infection through rape. We have about 5 within the last 3 months, which is very high, and especially in this era where we have a lot of medication to prevent HIV spreading. Yes.
Okay, before we wrap up, Madam, I don't know how to put this, but I'm curious about if I could take you back to gender-based violence, because I want us to imagine a scenario where, say, a woman has been abused by their husband, has been beaten, you know, physically and all that. And, you know, we are usually told as women or even the men, if you see a man, if a man slaps you or vice versa, then you should leave. But most of the times, truth be told, that is not usually the case. So this woman comes to you because her husband has done that to her, but she will go back to the man, right? So do we have anything, any form of system that addresses that? I don't know, looks for the man, talk to him, or vice versa. I don't know how to put it, but do we have such solutions for women facing gender-based violence and men too?
A lot of time, the violence perpetrators are also sick individuals. And we are not ignoring them because they are perpetrators, yes, but they are also sick who could need help. But for us, once the individual who has been raped, regardless of if it's the husband or is even an intimate partner, we first of all deal with that person and treat them. Once we treat them, we engage them on a long-term psychosocial support. And during the counseling, the therapy that they go through, they are able to decide to bring their partner to be able to get help. Sometimes for the intimate partner, the violence could be initiated by something a trigger could be something very small that once they go through therapy, they can be able to address. What we do not do is that we do not advocate for the partner, for the individual to separate to the partner. We encourage them to address the issue. But let's say the individual wants to separate. We have partnered with other organizations that are what we call the rescue house, where the individual can go there and get time off just to think through and go through the pain they are experiencing and be able to address when they're in sober mind, when they have already internalized, and also come to terms with what is happening. But if the individual decides they want to bring their partner for counseling, I said you are professionally trained psychologists here who will be able to go through the process of counseling, giving them therapy for a long time, not just one time, long term for them to be able to adjust. And then we leave them to make a very informed decision based on where they want to take their life after. Key thing for us is quick response. We are calling WEMA Center, WEMA Prevention and Response Center, because for us, it is a quick response to ensure that the individual does not get infected, the individual gets help as quick as possible. We have a toll-free line that is 24 hours with our clinician on standby to respond to the individual wherever that time they call. The challenge is now we're experiencing lockdown. We are not able to pick them or to be able to serve them at night. But we are hoping once we have cleared our time and we have gone back to 24 hours of operation, we'll be able to give them services throughout. Yes.
Okay, please, just allow me, my director, in just under a minute, please. We're completely out of time. Allow me. Let me get your closing remarks. You've mentioned the toll-free line there. You've not told us which is it. Let me just get your closing remarks in under a minute, please.
Okay. For me, closing line is that silence on GBV is a silent killer. When we keep quiet to GBV, we are encouraging and the perpetuation of what message is that let's talk about it, both for the survivors and for the perpetrators and for community, for the neighbors, for us, the professionals. Let's talk about it. Wherever you come to and in contact to anybody, talk about it. We cannot continue keeping silence. And if you really are out there and you need our help, feel free to reach us on 0800720633. And I'll repeat the number again, 0800720633. Any time of the day, and we'll be able to respond to you. Thank you.
Great. Thank you, Madam Gloria Gaki, the CEO, SWAP Kenya. We appreciate you for taking your time to join us on Bottomline Africa. Let's move on. With public gatherings banned in Angola, a new app is giving artists a new way to perform by paying for a paying public from the comfort of their homes. Let's get more from Tom Scully.